We're talking about neck pain, causes, treatments, and prevention on HealthSource. I'm Dr. Scott Fuller. We're going to talk about improving your quality of life, and being a chiropractor and a healthcare professional, we're going to focus on prevention. I know many of you watching this show have neck pain right now. We will talk about that. We'll talk about what is wrong with your neck and how we can find some solutions for you. And then down the road, if your neck pain does go away, we want to talk about how you can prevent it from returning. It is all about improving your quality of life, right? So I'm a quality of life doctor. That's what we're going to be talking about on this show. First, a disclaimer. This is not medical advice that I'm giving you. In other words, before you try anything that I recommend on this video or any of my other shows, consult with your medical physician, chiropractor, or therapist first before engaging in any of my recommendations. Most neck problems do get better with conservative means. Chiropractic is included with that. Some cases do need surgery, most of them do not. So we're going to talk about conservative solutions for you today. My first case study that I'd like to introduce to you is one of my favorites. This is my patient, Jean. She wrote me such a wonderful testimonial. It's also on my website. She came to me 15 years ago. She had residual neck pain from a car accident she had 10 years prior to coming to see me. She had right-sided neck pain. It radiated into her shoulder blade, down into her right arm, and over time it radiated down further in her spine. Her neck was stiff. She had that decreased range of motion, you know, the car test that I call it, right? You kind of can't turn your neck. You have to turn your whole body when you're driving and so forth. So she had a decreased range of motion there. She was never told why she still hurt, but medically she was given drugs to mask her pain. She suffered for 10 years before seeing me, and actually she saw my cable television show, HealthSource, 15 years ago and decided to make an appointment. I probably did a show on neck pain. Okay. When I took x-rays, I identified a loss of curve in her neck, 119% loss of curve. Later on I'm going to describe neck curves and how they're related to neck pain. She had a moderate amount of disc degeneration in one spot in her neck. So one of her discs was degenerated, also called arthritis. More on that later. In 1 week of chiropractic treatment, she had significant pain relief, including relief in her arm pain. And after 3 weeks, her pain was almost gone with occasional flare-ups. I gave her the option to stop care at that time, which I do with all of my patients, but she decided to fix the problem or get it corrected to address those spinal structural problems, that reverse curve that I mentioned earlier, and that degeneration in that disc. So I worked on her 3 times a week for 3 months. We repeated the x-ray, and her neck curve improved by 20%. She also felt fabulous at that time. To this day, she still comes in once a month for wellness and maintenance care. She's back to exercising on a regular basis, and when she takes vacations, she doesn't have any pain taking vacations at this point. So very, very good case with excellent results. So people always ask me, do I need that much care? In the case of Jean, she came 3 times a week for 3 months. No, you don't. She decided to go after additional improvements as time went along, and that was her choice, but she had much better results when we did that, and I'm going to talk about that as we move along. So symptoms that some people have in their neck can be varied. Some people just have stiffness that I had talked about. You can have an ache in your neck. It can be on the right side or the left side. You can have sharp pain. You can wake up with a crick in your neck, right? Where you wake up and then you just can't move your neck, one of these deals. You may or may not have arm pain. Your arm pain can also be varied. It can be numbness, tingling, buzzing. You can have aches. You can have sharp pain down your arm and so forth. One caution is if you have neck pain and left arm pain, in addition to chest pain and pressure, nausea, vomiting, sweating, blood pressure issues and so forth, particularly if you have any issues with cardiovascular problems and so forth, what does that sound like? It does sound like you could be having a heart attack or a heart problem. That is an emergency situation, and dial 911. For most people watching this show, that's not going to be the case, but just keep that in mind, okay? So you can have arm pain down the left arm, the right arm, both arms, and so forth. If you also have very severe pain that's getting worse and not changing, what you might want to consider is an emergency room appointment or a visit with a neurologist or orthopedist. So keep that in mind too. The rest of you, these other symptoms are usually dealt with conservatively. Also, there's that headache connection. A lot of people, almost every headache that people have, almost all, not all, but almost all headaches come from the neck. I have a case right now where a man has a constant headache, and he's had a constant headache right here above his eye for a year. He's been CAT scanned and MRI'd and tested and drugged and everything else, and nothing's happening. Now, he has no neck pain. I press my finger on the right side of the base of his skull, and it increases his headache pain. We know it's coming from here. Many of you have headaches with your neck. You know, when your neck gets stiffer and achier, you get headaches along with that too. Of course, when we clean up the neck and take care of that, your headaches go away, and that includes migraines. I'll be doing a show on just migraines in the future. Let me talk about another case study for you. This is an excellent one. This is a 36-year-old female. In 2012, she started going to yoga, and after doing yoga for a while, she started developing some neck pain. She would get sore after yoga. One side note is, with all of my patients, not only do I look at the problem and the complaint that they have, but what I also do is look at your life, and I look at the workstations that you have, and I look at the exercise programs that you're doing, things that you might be doing that is aggravating the pain that you're having. Then we'll make modifications and adjustments to that. In the case of this woman here, we make modifications to her yoga. So she's back doing yoga, but she's doing things a little bit differently now, so she doesn't go and re-injure herself, right? Modifications to workouts are things that we always do. So I took an x-ray of her neck, and yeah, sure enough, her neck is straight. There's no curve in it, 93% loss of the curve in her neck. And of course, she and all of you asked the question, how did my neck get that way? Well, the first trauma that we undergo in our life is birth. So we're manipulated and obstetrically pulled and yanked and forceps and C-sectioned and so forth. And so our neck is injured from day one. And I always ask the question, if a baby looks like this at week 2 or 3 or month 2 or 3, when should we take care of this? Of course, we should consider taking care of that early on, and I do that. I work on babies. More on that later. I've got the best research for you. Now, this woman that I'm talking about has great, exceptional flexibility. Actually, she's too flexible. So we started working on her, and after a few weeks, she's doing great. I'm doing some manual treatment on her and non-manual chiropractic techniques. More on that a little bit later. So what is causing pain? Let's get into a little bit of the anatomy that we can be having that's causing pain. First of all, this is important. Most of you do not have a muscle problem. I think I have a tight muscle. People will come and say, I think that this is a pulled muscle, is what a lot of people say. Not really. Almost all of you, you're having more than just a muscle problem. And I talked about this when I talked about lower backs. So in the case of a neck, if you think of a sprained ankle, when you roll and sprain an ankle, if it doesn't get better in 2 days, it's more than just a muscle problem. The same structures in the ankle are the same structures in your neck. In your neck, you've got these cartilage spacers in between the bones. Those are pads of cartilage, kind of like the cartilage in your knee, and those separate the bones. Those are inflamed and irritated in neck pain. In some cases, they can be bulged and herniated. In some cases, they might not be. By the way, some people can have a fancy test like an MRI, and the MRI comes back normal, which means that there is no disc bulge or herniation. Guess what? The pain can still be coming from your discs. We can do an MRI or an X-ray on an ankle, and that comes back negative. The X-rays come back negative, and the MRI comes back negative. Well, you still ripped up your tissue. It just wasn't big enough tear to see on X-ray or MRI. So the cartilage pads or discs are causing pain. On the back side of the neck here, on the back side of the neck, you have all of these joints. You have 7 on one side and 7 on the other. They work like knuckles in your hand that allow your neck to move. Okay? These knuckles here, or joints, can become inflamed. And look at how small that neck is. In this little area, you've got a lot of stuff packed in there. You've got 7 joints on one side, 7 joints on the other. You have 6 discs. You have ligaments holding everything together. You have muscles and tendons also involved in pain, but not the primary cause. Crisscrossing everywhere, also doing this as well. When I work on somebody and I give you a diagnosis of a neck problem, it's all of these soft tissues. The discs, the joints, the ligaments, and the muscles and tendons. That's why you don't get pain relief right away. It takes time for these things to heal up. Just like the badly sprained ankle can sometimes take months to get better. Now, you can have other causes of neck pain as well, not just inflammation to those tissues and injury to those tissues and chronic stress over time, but you can have inflammatory arthritis that's causing it. You can have osteoarthritis, rheumatoid arthritis, gout or gouty arthritis. You can have psoriasis or psoriatic arthritis. That can be causing pain too. Fibromyalgia problems. You can have just general body inflammation as well. When I suspect that something else can be causing your pain, I refer back and forth to medical physicians that care about you. So I will send people out to medical physicians just like I did last week. And medical physicians, when they learn about me and my care, will refer cases that they know is not going to get better with their care into my office. So that's the way it should work. We're here to help you. So if you have a situation that I can't help, I refer that to your medical physician. Or if they have something that's mechanical or neurological, they refer that to me. That's how the world's supposed to work in healthcare. Let me give you my next case study. This is a 52-year-old man. He comes to see me. He developed terrible neck pain and upper mid-back pain after resurfacing his driveway and after a long plane trip. When he came to see me, he could not lift his chin at all, not even 1 degree without terrible pain. He could barely get through his workday, and he could not work out of the gym at all. So what did I do? I took an x-ray, and guess what I saw? He had no curve in his neck. He had an 86% loss of curve in his neck, and he had moderate disc degenerative disease. So those disc pads that I described earlier were worn down in several spots. Medically, they call that arthritis. I use different words to explain to you what's going wrong. I call this wear and tear. I call this rust. And I explained to him, and now you, it's kind of like the tires on your car, right? So let's say you buy a brand new beautiful car, and on the way out of the dealership you smack a curb, but don't think much of it. You drive 20,000 miles, the car feels awesome. Smooth as silk down the highway, running great. You bring it in for general maintenance, and they say, hey, one of your tires is all worn down, it's ready to blow. You thought, what happened? I don't know what happened here. What it was is the tire was misaligned, the wheel was misaligned for 20,000 miles, but the problem didn't happen over time. It was an accumulation of wear and tear in that tire over time, and eventually that wore down in one spot because it was out of alignment, like necks can be, like no curve in the neck and so forth. That's what's going on here, and you don't know this for 20,000 miles, or you don't know it for 52 years in this case. In 5 weeks of care, his pain was an 8/10. It was actually more like a 10/10. And we got his pain down to 1/10, and his range of motion almost back to normal. He was back to working out at the gym and no pain during the workday. And this is important because it is all about quality of life. No increase in pain back to work, and he was back working out and very, very happy again. In this case, and I wanted to point this out, this is very important, I did not once use a manual chiropractic adjustment on him. I didn't move his bones or put gas into his joints like that. I didn't do the cracking, popping type of adjustment, not once in his case. I did a light force instrument adjustment. I did some soft tissue work. I also use a cold laser in my office. It's called low-level laser. You can look that up on the internet, or cold laser or therapeutic laser. So I used a laser on him. I gave him homework. So there were specific home exercises that he started slowly and built up over time. You can look at those exercises elsewhere on my website and in my book, Happy Back, and on my YouTube page. I give him sitting ergonomic changes. I also talk about that in my book, Happy Back, and I also discuss that in my videos. So I put together a package of stuff. I just didn't give him pain pills and sent him on his way, hoping that he would get better. Pain pills wouldn't get his 86% curve loss back. Pain pills wasn't going to help his discs heal. Pain pills wasn't going to improve his range of motion and get him back to the gym. We all hoped that that would be the case, but it took 5 weeks of intense work to get him back in shape. He will now be on permanent maintenance care, which everybody should be, just like oil changes for your car. He's going to be doing these exercises for the rest of his life to keep his neck from degenerating back into that condition that led him into my office. It's not fun when you can't move your neck and it hurts to sleep and move and work and play with the kids and drive your car and you can't go to the gym. That's not fun. It is all about quality of life. So, how did his neck get this way? It's the same thing. It's kind of like your teeth. Your teeth, that enamel decays over time, but for many, many years it can be unannounced. In the case of this 52-year-old man, it was a wear and tear process that happened unannounced. But it was deterioration and degeneration. Of course, it happens from childbirth that I said earlier, and childhood injuries. When we learn how to walk, we step a couple times and then fall and crack our head. We step a couple more times and fall again and wrench our neck. We do that every day. And then we start playing contact sports. And then we sit at a school desk like this for, 20 years. And then you get a computer job because sitting is the new smoking, as my colleague Dr. Stephen Franson likes to say. Sitting is the new smoking, so you sit like this in front of your computer for another 30 years, and then you go and resurface your driveway and go on a long trip, and then you have neck pain. So when did that neck pain start, or that neck problem start? It started 52 years ago when he was born, but he didn't have any neck pain for 52 years. Interesting, huh? So when should we take care of that neck? We should take care of it along the way. When should you take care of your teeth? When you have teeth. When should you take care of the car? When you buy it. So I'm proposing the same thing. When should you take care of your spine? You take care of your spine when you have one. That means when you're born, you only get one spine. When the car blows up, you can get a new car. When your teeth fall out, you can get new teeth. When your spine degenerates and is totally arthritic and broken down, you can't get a new spine. You only get one spine. You have to take care of the one that you have. That's very important. Poor posture, exercise, sports, boot camps, new gym workouts, home DVDs, and so forth. I always talk about children. As the twig is bent, so grows the tree. That's why my parents brought us in as kids for chiropractic care. So we should take care of these things throughout our lives so we have a better quality of life. When I talk to all of my patients and tell them, do you want to end up like this for the last 20 years of life? Everyone says, no, I don't want to do that. So then I say, come back to me every once in a while and make sure you do these things. Oh, of course, I have to tell you that maintenance care at the chiropractic office is never covered by your medical insurance. That's why we don't call it health insurance in my office. We call it medical insurance. We call it disease insurance because it only pays for you when you have a sprained ankle or a sprained neck or a sprained back. Once you're out of pain and you're coming in, say, once a month, whatever it is, for maintenance care, that's not covered by medical insurance. So very interesting. That's why I call it medical insurance or disease insurance. It's not health insurance. Health insurance is you doing the steps to keep yourself in shape. Those exercises that I prescribe to all of my patients, which you see on my YouTube page and which you see on my website and in my book, Happy Back, you continue doing those and then you work with me. Let's look at another case study. 45-year-old female. She originally saw me a few years ago for right hip pain and sacroiliac pain and groin pain after she did a workout lunge and she felt some pain and then she would get pain running. So we cleared that up. A couple of years later, her neck gets stiff. This is recently now. And she gets some tingling and buzzing in her right arm. So what did I do? I did an orthopedic neurological evaluation, posture evaluation, and I took an x-ray. What did the x-ray show? You bet, 124% reverse curve in her neck. She had no idea that that was there. Then she said, Dr. Fuller, how did it get that way? And taking her history, I realized she was a classical dancer from age 2 to 28, and she's 45 now. A gymnast, she does yoga, she was a cheerleader, and she had a car accident. You just kind of piled it on, didn't you? And then that led to this neck problem, and then finally at age 45 it started bugging her. So that's very interesting. We'll be working on her, and I anticipate no manual chiropractic treatment will be done in her case. In some of the other cases, I did do manual treatment. In her case, and the 52-year-old man, I didn't at all. A lot of people erroneously believe that the only thing the chiropractors do is pop joints, and that's it. As you can see with a lot of the things I'm describing today, we do a lot more than just that. There's a lot of tools in our toolbox. Consider looking into my book, Happy Back, because that talks about all about that maintenance type of stuff and ergonomic changes and so forth. So when you have neck pain, what are the solutions? The solutions are get an appropriate evaluation. I know a lot of people use chiropractic as the last resort. First they'll wait, and then it doesn't get better. And they might go to their doctor, they might do the orthopedic thing, they might do the x-ray thing, they might do the drug thing. And then eventually they end up in my office. What we do is, in chiropractic now, we should use it more as prevention and wellness because that's true healthcare. But what we do in my office, I do a full health history as I'm describing. Then I do appropriate examinations, orthopedic and neurological tests and so forth, chiropractic checks, postural checks. We do take x-rays if necessary. I'll review other tests if they've been done. Of course, I always recommend ice and not heat. When you roll an ankle and it blows up like a balloon, you have inflammation. Are you ever going to put heat on that? No, only ice. So the same thing with a sprained neck or a sprained back or a sprained ankle, you ice it down. How about a week later, if you're still in pain and it's still swollen, should we switch to heat? No, we continue to recommend ice. More on that some other time. Ice is the way to go. Why does everybody still recommend heat? Because heat feels good. When you put heat on, it feels good, so you think, gee, I must be helping myself. But you're just increasing the inflammation, so the next day you're hurting worse, so you throw more heat on it. So you're putting a blowtorch on a sunburn. Not a good way to go. Then you get into the chiropractic treatments, the stretches, the ergonomic changes. A lot of that is on my videos on my YouTube page. Now I have some of the best studies for you about necks and chiropractic care and other things you didn't even know. I have been talking a lot about this curve in your neck. You're supposed to have this nice curve to the front. Let me show you over here. So if this was the spine in me, you're supposed to have this nice forward curve like so, a 42-degree curve, okay? And in all of these cases that I told you, everybody lost the curve to a certain extent. It's either straight or in some cases totally reversed, okay? So what about this curve? How is that related to neck complaints? Research article, Journal of Manipulative and Physiological Therapeutics in 2005, title, Determining the Relationship Between the Neck Curve and Neck Pain. Conclusion, we found a statistically significant association between neck pain and a loss of curve by half or worse. All of the patients that I talked about today had way worse than that. And maintenance of the proper curve of 31 to 40 degrees, normal, the best being 42, should be a clinical goal for treatment. And you best believe I'm always working on this and recommending exercises to improve that, because the worse the curve, the more neck pain you have. Next article, these articles just get better. Heart rate changes, how the heart's working in response to mild mechanical irritation of the high cervical spinal cord region in babies. Listen to the journal, Forensic Science International. Now, why would there be a neck article in Forensic Science International? Because it was dealing with sudden infant death syndrome. And what this article in 2002, so 10 years ago, states, in first world countries like the United States, sudden infant death, SID, is the most common cause of death during the first 12 months of postnatal life. So they were studying that. In this study, infants between 1 and 12 months of age were given upper neck chiropractic adjustments if they were thought to be at an increased risk of sudden infant syndrome, as they're calling it, by noting as follows. Asymmetries in the horizontal and sagittal plane of body posture and motion. Asymmetry in the atlanto-occipital C2 region was determined by x-rays. So in other words, misalignments of the top two bones of the neck were shown to be significantly related to sudden infant syndrome, they're calling it. So what they did is they found these chiropractic treatments were changing heart rate and breathing and even flushing response in the skin. Sympathetic controls. Awesome study. Again, for 120-something years, we've known this to be the case in chiropractic. This article is saying, yeah, this is important. How safe is chiropractic treatments for young infants, posed the question by this article. The chiropractic theory has proven to be a successful technique which can be used to treat disorders, especially cerebral disturbances. Cerebral disturbances? Brain disturbances of motor patterns of various etiologies. Wryneck, C-scoliosis, irritation of the brachial plexus, the nerves coming off the neck. Sensoromotoric disturbances of integration ability, which means sensation and coordination problems, as well as pain-related entities such as crybabies with 3-month colic or hyperactivity with sleeplessness. Can you believe that? They're talking about if the top 2 bones of the neck are out of alignment, it can mess up lots of stuff, including colic and sleeplessness and motor pattern problems and cognitive stuff. In older children, disturbances of this kind are known as retardation of development in motor patterns as well as sensory abilities. That is unbelievable. Forensic Science International coming out and saying this stuff, it gets better. The prevalence of these disturbances are as high as 18% in children. Chiropractic treatment seems to be the most successful therapy which helps treat such disorders. Therefore, chiropractic treatment and manual therapy has become increasingly popular over the past decade. We can report, now follow this, we can report that 20,000 children treated without serious complications with the adjustments in the neck. Very gentle stuff too. Thus, our findings are consistent with the possibility that a mild mechanical irritation of the upper neck may trigger first steps in the event that lead to sudden infant death. I wonder when we should check the neck, when we're 51 years old or 45 years old or 31 years old or at age 0. That's the Forensic Science International for you. Next article. You might have remembered this one. I've talked about this one. Dr. Timothy Johnson, who's on TV in the Boston area, reported on this 5 years ago. Atlas Realignment and Achievement of Decreasing Blood Pressure, Journal of Human Hypertension, 2007. Abnormalities of the cervical spine at the level of the top bone in the neck are associated with relative ischemia of the brainstem circulation and increased blood pressure. Precise chiropractic adjustments, by the way, this was not manual adjusting, by the way, light force adjusting by a chiropractor, delivered in this study were able to decrease blood pressure. Systolic decreased 17 points, diastolic decreased 10 points, and blood pressure that was sustainable over an 8-week period with no adverse effects. Restoration of alignment of this bone was as good as typical 2-drug therapy to reduce blood pressure. Therefore, the chiropractic treatment was as good as using 2 drugs to decrease blood pressure. This was the first demonstration of a sustained blood pressure lowering effect associated with a procedure to correct the alignment of the atlas vertebra. Note, this is important, that pain was not present, no neck pain, in any of the patients randomized in this study. No one had neck pain. They worked on misalignments. Blood pressure went down significantly. Awesome studies about the relationship of the neck and your overall body function, not just relieving your neck pain. How about that for quality of life? That's awesome stuff. I have time for one more patient study. Patient of mine, 38-year-old male. He was a hard motor dirt bike rider. He went for a hard ride. Ever since then, he had neck pain, left shoulder pain, in the shoulder blade, down the arm, off and on. Working at the computer increased his pain. Sleeping in funny positions increases pain. This went on for 4 years. I took an x-ray. What did I see? That's right. A loss of curve by 76%. It was almost straight. Slight degeneration, rust, wear and tear in one spot. One of the tires on his car was showing wear and tear. After 6 weeks, he had a full recovery. No pain at all in his computer, nothing in his arm. I used manual and non-manual chiropractic treatment in his case. He is now under maintenance chiropractic care, and I have him on, hopefully, permanent daily spinal exercises like brushing your teeth every day. In all of these cases that I'd mentioned today on this show, when should people come back for care? In my opinion, they should come back for wellness and maintenance care, because we already were told by this research that misalignments in the neck can increase colic, can increase sleeplessness, can increase motor patterns, cognitive development. It can change blood pressure. It affects everything in your body, not just maybe having neck pain later. Talk about quality of life. When should people stop doing their exercises and ergonomic changes? I propose to you never. You should always brush and floss your teeth. You should always get the oil changed in your car. You should do these things for yourself. It is about quality of life. Remember that wellness chiropractic care, although I recommend it, is not covered by sickness insurance or medical insurance. We don't have health insurance. It is all about quality of life. I am a quality of life doctor. Consider a chiropractic evaluation. Look at all the information that I have available online. I'm Dr. Scott Fuller. Please join me again.